The treatment of thrush should be comprehensive and correct from the very moment of diagnosis. Well, this can include ointments, creams, vaginal suppositories, and douching. At the very early stages, at the very beginning, douching alone is sufficient. Douching with a solution of cetyl. It is very effective and is based on chlorhexidine. It is enough to douche with it, as indicated in the instructions for dilution, for 5 days. After that, suppositories or vaginal tablets are recommended. These include soluble clotrimazole vaginal tablets, Genferon suppositories, clotrimazole, Viburcal, pimafuscin cream, as well as Acneror cream, which is very effective, and clotrimazole cream as well. So these are simply local remedies that are used at the very early stages of thrush symptoms. As for taking medications orally, it is generally recommended to use tablet forms, specifically those containing fluconazole. These include fluconazole itself, as well as brand names such as Difluzol, the same fusis, Flucostat, Mycocyst, and Diflucan. All of these are essentially different brands or types of fluconazole available in tablet form, and they are used to treat the same conditions. A dose of 150 milligrams for 2 or 3 consecutive days is usually enough, and the acute form of thrush goes away. But if the treatment is interrupted or not completed, right? Or if the sexual partner in cases involving women does not get treated, then the disease can become chronic. And you can end up treating it endlessly like that. When chronic forms of thrush are already present, then the treatment, of course, becomes quite complicated and complex and demanding for the patient, because at this point, a combination of more serious and potent antifungal medications is generally required, and the process can be even more challenging and time-consuming for those affected. This is a different group, not fluconazoles, but itraconazoles. For example, ketoconazole is taken for quite a long time, about a week, 10 days, or in repeated courses. Immunomodulation is essential because at this stage it is already related to the immune system. The immune system becomes weakened, so it needs to be stimulated. Medications such as Immunofan, cycloferon, polyoxidonium, and Ingistal Bihil are used. So there are many additional accompanying medications as well. For example, Traumel is added to the mixture, as well as coenzyme, yes, and also compositum, in order to help the body respond more easily and effectively to this kind of infection. That's it. As for local symptoms and local treatment, again, the same CTL solution is used in chronic cases, right? Douching, suppositories like Genferon, Referon, Viferon, these are excellent suppositories. The cream Acneror works very well. So all of this should be done for quite a long time and in a comprehensive manner. In some cases, there are antifungal medications that can also be administered as drops. It all depends on the state of the immune system, the condition of the vaginal mucosa, and the patient's complaints. At the same time, of course, you also need to follow certain dietary rules, since diet can also be associated with the manifestation of candidiasis. That means sweet foods, short crust pastry, all kinds of rich baked goods. Spicy and salty foods are also generally not recommended. It is necessary to eliminate alcohol. That is the most important thing. Well, what else would I like to add? In order to completely cure a chronic condition in a woman, these antifungal medications, whether it's fluconazole for some, ketoconazole for others, are used, right? So it is actually very individual. It is also necessary to take them during those times, specifically during the critical days of the menstrual cycle, in order to completely eliminate the infection. And this should be done for 3 consecutive months. That is, during menstruation, on the 1st to 3rd days, it is essential to take the same fluconazole, 150 milligrams, but you need to do this for about 3 months in a row. Only then will the criteria for recovery become clearly visible, and chronic candidiasis will start to go away. At the same time, the man must also undergo treatment together with the woman. And during her critical days, he should also take the same medications along with her. After that, follow-up is done to monitor and confirm recovery.